Now let's talk about some of the causes of cancer. An important cause I mentioned earlier are chemical carcinogens. They represent about 2/3 of all known etiologies leading to cancer. When we talk about the process of carcinogenesis in general, is a multi-step process, and there's a sequence of changes that have to take place. One change is called initiation, or where we're producing a mutational change either in a proto-oncogene and or tumor suppressor genes, and then followed by an expansion of that cell population by having it proliferate. We call this promotion. Remember that all chemical carcinogens are mutagenic, but not all mutagens are carcinogenic, and that's good to know. So what are initiators? These are the ones that have a property of the chemical carcinogen that basically can be direct acting on the DNA leading to mutation, like a point mutation, for example. It can be indirect acting by being metabolized, like in the cytochrome P450, if you're going through the liver, to become, initially it's called a procarcinogen, and then it becomes an activated carcinogen once it becomes metabolically altered chemically. Promoters are those that are going to cause the cells to proliferate that are mutated, expand that population clonally, and therefore leading to the likelihood of more mutations being acquired, and then therefore leading to a neoplastic phenotype. And this additional mutations obviously takes time. You should always remember that carcinogenesis in the human population, this becomes important at many levels for various organ systems, that it takes years to decades to develop tumors. That's why, for example, you can do screening tests at a certain interval of time, knowing that because it takes years to decades to develop, you can pick it up early and then intervene and do the appropriate intervention clinically and mitigate or get rid of the probability of getting neoplasia, like doing a pap test every 3 years, because it takes anywhere between 10 to 15 years to develop cervical cancer. So chemical carcinogens, what are some important ones? Since they like to ask about etiology of diseases, obviously in the gastric cancer, we have to think of nitrosamines. That's why, for example, pickled vegetables, like in Asia, have a propensity to have high levels of carcinogens in them, and if you chronically ingest these foods, that can increase the risk for gastric cancer. An important entity that we'll talk about in the environmental path or lifestyle pathology section following neoplasia is cigarette smoking. Since there are over 4,000 organic waste products in cigarette smoke, there's well known to have at least 60 carcinogens in cigarette smoke alone. And so there are many malignancies that can be associated, and we'll get to that when we get to the smoking. Another important set of chemical carcinogens are what are called polycyclic aromatic hydrocarbons. And a classic one for this is benzopyrene, which can be found in incomplete combustion of organic material like smoking a cigarette, marijuana cigarettes. It doesn't matter what you smoke, Kaplan notes, whatever you like to smoke, it will increase the risk for carcinogenesis. Asbestosis or asbestos, basically these fibers, this is a physical or chemical nature in terms of causing cancer. We think of bronchogenic and malignant mesothelioma neoplasias. We'll talk more about that when we get to environmental path. If you're a miner, you have to worry about chromium and nickel. They inhale these metals that can now cause lung cancer. An important metal as well that's known to produce cancer is arsenic, and it leads to increased risk for squamous cell carcinomas of the skin and lung. And a rare tumor, except on the USMLE, is angiosarcoma of the liver, a malignancy of the endothelial cells lining the sinusoids of the liver. One they like to ask on step 1, step 2, and step 3 recurrently is vinyl chloride, the monomer that's used to make polyvinyl chloride products we buy in the stores and other areas, and so it can also lead to angiosarcoma of the liver. Aromatic amines or azo dyes, you think of hepatocellular carcinoma. Alkylating agents can lead to damage to hemopoietic cells and lymphoid cells, leading to leukemias, lymphomas, and other cancers. Benzene, you think of the organic lab, but one of the constituents of cigarette smoke, marijuana smoke, is benzene. It's estimated about 15% or 14% of leukemias in the United States can be directly attributable to exposure to cigarette smoke and the benzene content that's found there. Naphthalene, again, it gets excreted into the urine, and where's it going to sit in the bladder? It can increase the risk for urinary bladder carcinoma, typically transitional cell carcinoma. Another important carcinogenic agent that as healthcare providers that we can be exposed to is radiation. One, besides ionizing radiation, we're going to talk about that's probably the most common cause of cancer is UV radiation, because the most common human cancer is basal cell carcinoma, squamous cell, followed by malignant melanoma. In UV radiation, we acquire about 80% our UV radiation in the first 18 years of our life. While we're indoors studying for the USMLE, we're not going to get increased likelihood because of we're not going to get from fluorescent light UVB radiation. So it's the UVB, or sunlight, is the most carcinogenic. When you think of those tanning booths, what is the UV radiation for those that like to be darkly pigmented? Is UVA, and they should be renamed as wrinkle booths, because what you're doing is just not only causing mutations, but you're causing damage to the dermis, the elastic fibers, and it degenerates, and that's why you'll notice people who have been out in the sun too long, that if you try pinching their skin, it sort of sags. It takes a little time to go back to its normal state. So you're paying for wrinkles when you go to a tanning booth. Just be happy by the pigment in your skin, what you have. What's going to happen with UV radiation is you're going to produce a number of pyrimidine dimers. And these pyrimidine dimers are going to lead to transcriptional errors and mutations of those proto-oncogenes and tumor suppressor genes, and increasing the risk for basal cell carcinoma, as well as squamous, as well as melanoma. And there is a genetic disease called xeroderma pigmentosum, autosomal recessive, where it's a defect in DNA repair. So obviously if you have these pyrimidine dimers, that this is not going to be able to be repaired, and they have a higher incidence for skin cancer. Another important radiation is ionizing radiation. And with ionizing radiation, we think of X-rays, gamma rays, alpha, beta particles, protons, and neutrons. And with ionizing radiation, what you're doing here is breaking chemical bonds and producing free radicals that can now interact with macromolecules and therefore cause mutational changes. And what part of the cell cycle, or parts of the cell cycle, are exquisitely sensitive to ionizing radiation is S phase, G2, and mitosis. That's why we use radiation as a therapeutic agent in killing cancer cells. We also use in other type of conditions as well, especially when you have a proliferation of cells, whether it's neoplastic or non-neoplastic. So you get cross-linking and you break various molecules, including nucleic acids, leading to likelihood of altering those proto-oncogenes and tumor suppressor genes. What are some historical examples of ionizing radiation that comes to mind when you think about the atomic bomb explosion in Nagasaki and Hiroshima? And you think of leukemias because of the ionizing radiation, because obviously hemopoietic cells are proliferating, and they'll obviously require mutations. You also, in ionizing radiation, producing radioactive iodine, which then can be concentrated in the thyroid, leading to thyroid cancer, and you can obviously get other type of cancers as well. And then uranium, we know it has radiation being emitted from it, and it can lead, obviously in minors, leading to primary lung cancer. The third important cause of cancer are oncogenic viruses. So the first class of virus you think of as RNA oncogenic virus, and there's only one that's associated, would probably ask on the USMLE, is the human T-cell leukemia lymphoma virus. And it's adult T-cell, and basically it's in the same family as AIDS virus, which is HTLV-3. This virus is called HTLV-1. In terms of DNA oncogenic viruses, there are basically 4 of these. One is hepatitis B virus, which causes or increases the likelihood of hepatocellular carcinoma. Epstein-Barr virus is associated with several cancers. One, as you're well aware of, they love to ask in the USMLE, is Burkitt's lymphoma, where you have that famous translocation of 8 to 14, where the c-MYC oncogene is translocated to the chromosome 14. Why is chromosome 14 important? Because you put it in the family of genes for the heavy chain immunoglobulins. And then it can also infect epithelial cells, leading to increased risk for undifferentiated nasopharyngeal carcinoma. Then human papillomavirus is a DNA virus, and it's going to obviously cause a variety of neoplastic processes, benign, for example, squamous papillomas or warts, or what we call condyloma acuminatum, and basically can also lead to carcinomas involving the cervix, vulva, vagina, penile, and anal. What does that list have all in common? Squamous cells. Remember, HPV has cellular tropism for squamous cells, and the ones that lead to carcinoma, as you're well aware of, is 16, 18, 31, and 33. There's a vaccine now being given to adolescent females to decrease the likelihood of getting these viruses. Eventually, it'll also be given to young males as well, because they have squamous cells on their penis, and the virus does not show prejudice no matter where it likes to infect. And what's important about how HPV causes damage is, remember we mentioned this earlier on, is that when we talked about apoptosis, that the HPV virus has what are called elongation factors, E6 and E7. E6 binds to P53. As we remember, P53 prevents mutated cells or damaged cells from entering the cell cycle. So now you allow these mutated cells to get into the cell cycle, as well as E7 binding to the retinoblastoma gene. That's important for regulating growth arrest. So now you won't allow growth arrest, and now you get proliferation and increasing likelihood of a carcinoma. And the newest on the block that's been described as a DNA virus is the Kaposi sarcoma-associated herpes virus, or another name for it is HHV8 for human herpes virus 8, and leading to the disease that we know as Kaposi sarcoma.